Welcome back to Neurology 101. I'm Dr. G, and in today's clinical medicine brief, we're wrapping up our cranial nerve syndrome section with a practical review of the cranial nerve exam, because no neuroassessment is complete without it. Whether you're preparing for the PANCE or your next rotation, this is your high-yield walkthrough. Let's dive in. Did you know the concept of cranial nerves dates back to Galen, a Greek physician in the 2nd century AD, who identified 7 cranial nerves? It wasn't until the Renaissance and the advent of human dissection that 12 were officially recognized, some with names still in use today. Let's look a little bit deeper into the patho. What is a cranial nerve exam? Well, the cranial nerve exam is a neurological assessment tool that evaluates the function of cranial nerves 1 through 12, which originate from the brain and the brainstem. Each nerve has a specific motor, sensory, or mixed function related to the head, neck, and or visceral control. This exam helps localize lesions, differentiate central versus peripheral pathology, and is a staple in evaluating strokes, masses, infections, and more. Let's run through each nerve quickly. Cranial nerve 1, the olfactory nerve. How do we test it? Well, we need to do a smell identification, usually coffee or peppermint, something that a patient can easily recognize. Now, cranial nerve 1 is not always tested in routine cranial nerve assessments because we don't always have smells hanging out ready to test our patients. That is why, in most cases, we see cranial nerves 2 through 12 intact documented. A pro PA tip: this is often skipped but important in trauma or neurodegeneration. We'll also see early loss in Parkinson or Alzheimer's disease. Moving on to cranial nerve 2, the optic nerve. How do we test it? With visual acuity, visual field testing, and fundoscopic exam. A pro PA pearl is we assess for papilledema, visual field cuts for stroke and tumor. Let's cover cranial nerves 3, 4, and 6 together, just like we did before. We have 3, which is oculomotor, 4, which is trochlear, and 6, which is abducens. We test these by performing extraocular movement assessments and pupil response, and also looking for ptosis in the case of the third oculomotor nerve. A pro PA pearl is think down and out for cranial nerve 3 palsy. And remember, we have a dedicated ophthalmoplegia episode if you want more details. Cranial nerve 5, the trigeminal nerve. This is both a sensory and motor nerve. We can test it via facial sensation of the 3 branches, V1, V2, and V3. We can also test the corneal reflex and test motor strength of the muscles of mastication, like the masseter. A pro PA pearl is sharp unilateral facial pain. Think trigeminal neuralgia. Cranial nerve 7, the facial nerve. We test it by doing tests of the facial symmetry. We have facial expressions like raising the eyebrows, closing the eyes tight, or puffing out the cheeks with air. A pro PA pearl is forehead sparing is usually a central lesion, whereas full facial droop is a peripheral or Bell's palsy. Cranial nerve 8, the vestibulocochlear nerve. We test it by testing the hearing via the whisper test or the Weber-Renée, and we can also test balance with the Romberg exam. A pro PA pearl is sudden hearing loss with vertigo. We want to rule out a stroke. Cranial nerves 9 and 10, glossopharyngeal and vagus. We test it by having the palate elevate and performing the gag reflex. We can also listen to the patient's voice. A pro PA pearl is dysphonia, dysphagia, or uvula deviation. Think vagus nerve involvement. Next up, we have cranial nerve 11, the spinal accessory nerve. We want to test it with the shoulder shrug and with head rotation, testing that SCM muscle. A pearl is weakness may follow neck surgery. Think of lymph node dissections. Last but not least, we have cranial nerve 12, the hypoglossal nerve. We test it by having the patient stick their tongue out. Remember, if they have tongue deviation, it deviates towards the affected side. You lick your wounds. There are a lot of different ways to remember your cranial nerves. One mnemonic that might help you determine whether they are sensory, motor, or both is this mnemonic. Some say marry money, but my brother says big brains matter more. Each first letter in that mnemonic associates with each cranial nerve. So S for some is sensory for cranial nerve 1, and so on. All right, some quick book med versus street med. Book med, you memorize to touch and feel, blah, 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 and the sensory motor mnemonics, and you know the test and their associated deficits, and it all looks good on paper. But in the street, you're asked to do a complete neuro exam on the ED or on the wards, and suddenly you're fumbling for the flashlight. This episode is here to help change that. Okay, let's do some practice questions. A patient presents with a left facial droop involving both the upper and lower face, and inability to close the left eye. Which cranial nerve is most likely affected? Is it A, cranial nerve 5, B, cranial nerve 7, C, cranial nerve 10, or D, cranial nerve 12? If you said B, cranial nerve 7, you are correct. Remember, facial nerve controls facial muscles. Complete hemifacial weakness suggests a lower motor neuron lesion like Bell's palsy. Question 2. On exam, the patient's tongue deviates to the right when protruded. This finding is consistent with the lesion of which nerve? A. The left cranial nerve 12, B. Right cranial nerve 12, C. Right cranial nerve 5, or D. Left cranial nerve 9. The answer is B. Right cranial nerve 12. The tongue licks its lesion or licks its wound. A right hypoglossal nerve, the lesion will cause the tongue to deviate to the right. All right, some final thoughts. That wraps up our cranial nerve coverage. Mastering this exam isn't just a box to check, it's the foundation for identifying neuro red flags quickly and confidently. Coming up next, we dive into vascular neurology, looking at TIAs, syncope, and strokes. If you found this clinical review helpful, don't keep it to yourself. Share it with your study group or tag a classmate. And as always, this is the Pro PA podcast, where future pros in medicine are made. Until the next episode.